Hello, everyone. Good morning, good afternoon, good evening, wherever you're joining us from. It's another beautiful Thursday. My name is Dr. Eugenia Caternor, and I'll be your host for today's episode of Transformation Talk podcast. We all know Transformation Talk is a platform to educate, to empower, to inspire, to uplift, and to promote change within our own communities. We share ideas. We talk about different things that is pertaining to us. We share our knowledge, our experience, and insight on different topics. And anybody can be a guest speaker. So if you're on and you want to be a guest speaker, just shoot me an email, text message, and we'll put you on. We want to learn more about things around us. So don't feel shy. Don't feel like, hey, you're not good enough. Anybody can share information. Okay. So if you want to get involved, you can always reach us at Dr. Eugenia Caternor at gmail.com. You can visit us on the website www.dreugeniacaternor.com .net. You can subscribe to our YouTube channel, which I will encourage everybody to do. So once we are having a podcast, you can get information straight to you. You can share, you can like, you can comment. I mean, it's for all of us. You can also follow us on Facebook and Instagram at Dr. Eugenia Caternor. We also get text messages or phone calls 443-623-6080. You can text us from WhatsApp or regular message here, Africa, Asia, wherever you are. You can always reach out to us. Okay. We are here again. It's July already. Oh my gosh, I can't believe we've already passed half of the year 2026. What are some of the things that you've planned to do this year that you haven't got to it, or you've started but you stop on the way? I will encourage you to go back and remember your first of the year resolutions, things that you say you're going to do for 2026. It is going faster than we can ever imagine. So if you haven't completed it, or even if you haven't started, it's never too late. It's better late than never. So you can start now. Today is another episode that we want to dive into by popular requests. We try to talk about anything. We've talked about health, we've talked about money, business, real estate. Think about it. Once people request, we discuss it. So it's amazing how a lot of people have reached out to me asking about obesity, people being heavy, people being overweight. Sometimes we think people don't care, but they really do. They really do about how they look, how they feel, all the changes that's happening in their body. So I was like, okay, we have had that discussion before, but yeah, if we want to talk about it again, I'm more than happy because that's one of my favorite topics that I like to talk about because, in a weight loss industry. I own Transformation Center for Weight Loss. We have multiple locations, and we are about to open a new location in Milford, Delaware. So if you live in Delaware, Milford, Sussex County, join us on Monday from 10 to 6 p.m. for our first day of opening the new location in Milford, Delaware. If you live outside of Delaware, outside of Maryland, and you still want to talk to us about weight loss, staying healthy, we'll be more than happy to connect with you because it's something that we all need to be serious about. I mean, we do a lot of things and we joke a lot, but when it comes to our health, we can't take it for granted. So today we'll talk about obesity. Is it just the numbers that we see on the scale? We go to the doctors and they tell us, okay, you're overweight, you're obese, you have to do something about it. Are we really doing something about it? And if we are, is it working? If it's not working, what can we do to fix it? Okay. We can't just ignore it. I have a lot of friends that have come to me and asked for help, and they are doing really, really well. So if you are my friend, if you are hearing this, If you are watching this, if you're on my contact, please, I don't want obesity to take hold of your life. So reach out to me and we'll talk about obesity management and how you can get back to your normal self. Okay. So today, well, our main conversation is going to be about understanding the true colors of obesity. And we know obesity affects anybody, regardless of who you are, where you're from, and the things that you do. Obesity can affect you. So please, if you need my help, don't worry about it. Reach out to me and I will help you. Okay. So, what is obesity and why do people talk about obesity so much? Okay. When you hear the word obesity, what comes to mind? A lot of people will say it's my weight, is my BMI, it's my appearance, is me eating too much, is me not do anything, but the weight is coming on and on. So today, our goal is to discover that obesity is actually a complex chronic disease, not simply a number on a scale. It's not just what you see on a scale, it's a disease process. Just like somebody have diabetes or high blood pressure or high cholesterol, obesity is also a chronic disease. Okay. And funny enough, a lot of the diseases that we have is linked to obesity. So obesity is causing a lot of this problem that we are so much concerned about. You have high blood pressure, you have diabetes. Have you thought about maybe if I try to work on my weight, those numbers can improve? Okay. So what I want us to understand today is obesity a big deal? And if it is, what is causing it and how can we stop it? Okay. So when we talk about obesity, a lot of people go to their doctors. They get on the scale and they give them a reading. They check their height and they give them a number. So then they divide the weight and then the height in meters, and then it gives them a number. So the numbers that you get determines whether you're underweight, healthy, overweight, or obese. Okay. So if your BMI is under 18.5, it's underweight. You're too small, you're too skinny. Okay. If it's between 18.5 to 24.9, it's normal, healthy weight. And I know we would say, oh, I have a big frame or I have a thick muscles or whatever. So my BMI doesn't have to be that low. No argument. It's okay. It depends on where the numbers are coming from. I got it. I understand. Okay. If your BMI is between 25 and 29.9, it's considered overweight. Now, with the obesity, there are three classes if you have obese. So there's class 1, class 2, and class 3. So any BMI between 30 and 34.9 is obesity class 1. BMI between 35 and 39.9 is obesity class 2. Anything above 40 BMI is considered obesity class 3. It used to be morbid obesity. Now it's obesity class 3. Okay. Does the BMI has limitations? Yes, BMI has limitations. So for instance, somebody who is very athletic, muscular, may have a BMI of 31, but only 10% of body fat. They are normal, they're fine. Okay. You can also have maybe an older person who have a normal BMI but high abdominal fat, which makes the BMI goes up, or normal, but the fat is there. It's not healthy. Okay. Somebody may lose muscle but gain fat whilst their BMI stays normal. That's also a problem. Okay. So the key message is BMI is only a screening tool. It's one screening tool, not the whole picture. It doesn't tell you everything about your weight, where the weight is coming from, and whether it's good or bad. Okay. So when obesity is considered a chronic disease, there are a couple of things that comes in place. Is excess body fat, is hormonal changes, inflammation, metabolic dysfunction, increased disease risk. Okay. It can affect your physical health, your mental health, your quality of life, your mobility, sleep, relationship, employment. All this can be affected when you're obese or you're overweight. Okay. Because when it affects you physically, meaning you can end up having other health problems as a result of the obesity. Mentally, a lot of people get depressed and become socially isolated because they've put on a lot of weight. They are ashamed to go out. Nothing they wear fits them anymore. So they can't even go to the parties that they used to go. I know people that even stop going to church because they can't fit into any clothes and they are embarrassed to even be among the people that they used to hang out with. Okay. Your quality of life, it can affect your quality of life. The way you carry yourself around. Some people are even ashamed to even get outside of the house. People cannot even get on a plane because of their weight. All these things affect you. Okay, your mobility. Oh, my back is hurting more than normal. My knee, my leg. If it's the obesity or it's the weight, why are we complaining instead of doing something about it? It can affect your sleep. When you're not sleeping well, always ask yourself, does it have anything to do with my weight? Because a lot of people that are obese also have sleep apnea. So sleep apnea can also cause difficulty sleeping, or you wake up tired because you didn't get enough sleep when you were asleep. Relationship. It can affect your relationship. Remember, when you got married, you were skinny, good looking, and all of a sudden, now you've gained all this weight. Now your partner may not be attractive to you anymore. Okay. It can affect your relationship. Employment. Some people have lost jobs because of their weight. Some people are having difficulty even finding jobs because nobody will hire them. Because when you're overweight, you become a liability to the company. More call outs, more taking sick days off, not being able to do your work as effective as somebody who is not obese or overweight. Okay. And I've already, mentioned before, sometimes even life insurance, you cannot get life insurance when your weight is above a certain number. I'm also a licensed financial advisor. I do life insurance for people. I've seen a lot of people get turned down, or no insurance company will give them insurance because of their weight. So think about all the things that will happen to you when you're overweight. Okay. So it cannot just be, okay, I'm overweight, so whatever. We cannot ignore it. We cannot take it for granted. Okay. Understanding the true colors of obesity. Obesity has many contributing colors. Okay. So I'm going to give you colors that goes with the issue. So if you're writing it down or you're taking notes, okay. So genetics. Let's say genetics is green. Okay. Your environment. Let's give that blue. Nutrition. Give that yellow. Stress, I'll give that red because stress is a major factor in our health. Sleep, maybe brown. Hormones, purple. Mental health, let's give that black. Social determinant, white. Okay? No single color causes obesity. It is usually a combination. One thing doesn't cause obesity. It's usually multiple things coming in place that can end up causing the weight issue. Okay. According to the World Health Organization, more than 1 billion people worldwide live with obesity. That's about 2 in every 5 adults is overweight or obese. Okay. So if we are 20 here, at least 8 or 10 of us will be overweight or obese. Okay. Adult obesity has more than doubled since 1990. And even our children, childhood obesity has increased dramatically over the past few decades. And we're seeing more and more of children being obese, and parents are watching their children gaining weight and gaining weight and gaining weight. Okay, what are we doing about it? We have to stand up and speak for our children, advocate for our children, find solutions for our children so they can live a quality life as an adult. Okay. Obesity is on the rise and is continuing to get worse and worse, both in children and in adults. And with me working with patients that are overweight and obese, I'm seeing more and more younger people struggling with obesity due to many reasons. Okay. And what are some of the reasons why these numbers are rising? Large portion sizes, the food that we eat. How much do we eat? What is the portion size? Well, how much are we actually eating? Are we reading the labels to see what the portion size is, or we just eating it because it's food? Okay. A lot of our foods now are highly processed. Highly processed foods have higher risks of making you unhealthy or making you gain weight. Less physical activity. We're not moving around much like we used to. Increased screen time, especially our children. We spend more time on the screen, especially in the summertime when school is out, the children are home, and we spend more time on the screen. It's not helping us, it's just making us more unhealthy. Chronic stress. Some of us live in stress. We swim in stress. We bathe in stress. Every day of our life is stress. Well, over time, that stress can also cause health problems, and obesity is one of them. Poor sleep can affect your weight and make you unhealthy as well. Sometimes our living situation or our lifestyles can be a factor to why we're gaining weight. Food insecurity, genetic, interacting with the environment, they're all issues, okay? So when we talk about some of the causes of obesity, we also talk about biological causes like hormones. There are a couple of hormones in our body that affect how well our body process the food that we eat. And sometimes we don't eat, but we're gaining weight because of the cortisol, the insulin, the leptin, the ghrelin that is working in our body. All those things can affect us when it comes to our weights. So, what are we going to do? We have to identify those issues and start working on it. So, don't say, okay, I'm fat, so that's all I'm going to do. Do something. Okay. Genetic causes. Genes affect our weight, hunger, our fullness, fat storage, metabolism. You can have two siblings eating similar thing or the same thing. One can gain weight easily and the other one remains small. I've even seen twins where one is very heavy and the other one is really skinny. And they eat from the same household, they make the same food. So genetics have a lot to do with it, okay? And also, when it comes to our environment can cause some of the problem. Okay, neighborhood without sidewalks, meaning we're in a car everywhere we go, or we can go out to even walk in our neighborhood. There are no grocery stores nearby, so we end up going far away or buying unhealthy things so it can last longer. So instead of getting fruits, vegetables, or fresh fruits and vegetables, we are forced to get more of the processed food because grocery stores are further away and we don't have access to the convenience stores or transportation. If we can drive to the store, then we are forced to buy food that will last longer. That means we are getting more of the processed foods, get canned foods. Those are processed food that can last longer. Okay. Places where there's more fast food restaurants than you know healthy restaurants. So you're forced to go to those fast food. It's cheaper. Kids sees it. That's where they want to go. And we also getting it for them and getting it for ourselves. Kids have sports activities. So when you're coming home from soccer game or basketball, it's 7 p.m., 8 p.m. Who want to come home and cook? So they end up stopping by the McDonald's or Wendy's or Burger King and grab some fast food. Over a period of time, this can be unhealthy for you. Okay. Long work hours. Sometimes when we are working long hours, we are more likely not to cook at home. We are more likely to eat unhealthy snacks to keep us going. We are more likely to buy food out instead of making food at home because we have limited time to cook. Psychological causes, stress eating. Some people, when they are stressed, they eat. Emotional eating. People eat for good emotions, for bad emotions. They are happy, they are eating. They are sad, they are eating. They are happy, they end up eating things that they shouldn't eat. Okay. Depression, sometimes depression can make you eat. Yes, some people lose weight when they are depressed, they don't eat. But most people eat more when they are depressed. Or if they have to put you on medication for depression, some of the antipsychotics can also make you gain weight. Okay. Trauma can be a factor. Some people have gone through so much trauma in life, which starting to affect them as they get older. Anxiety, boredom. We are bored, so we just grab food and eat. Loneliness. Okay. Or let's say, for instance, you're caring for maybe a loved one who is also not taking care of themselves, or they're asking for unhealthy food, then you're also forced to eat what you're giving them. I've seen people that work in, assisted living or home care, and they eat whatever their clients are eating. So if your client is not eating healthy, you're forced to eat the same food that they're eating. Okay. So now, medications. There are a lot of medication that cause weight gain. For instance, if you're on steroids, and you can be on steroids for different reasons. Steroids are life-saving medicine, but they can also cause weight gain. Some antidepressants, antipsychotics, even insulin can make you gain weight. So patients or people that have type 2 diabetes that are taking insulin, just watch out. Even beta blockers for blood pressure. All these things can contribute to weight gain. So whilst you're on this medication, just be more cautious and pay attention to your weight. A lot of birth control medications can cause weight gain, especially like Depo, Provera. A lot of people can gain 10, 15 pounds within a month or two. So pay attention to the medicines that you're taking, read the labels, read the information that the pharmacy gives you, go online, Google the medicine, Google the side effects, and see if weight gain is one of them. Yes, if you need the medicine, you need the medicine, but at least you are aware of it and you know how to manage your intake. Don't stop your medicine because you went to read on it and it says weight gain is a side effect. Talk to your doctor, talk to your healthcare provider, discuss with them. They may switch you to another medicine that cannot or will not affect your weight, or they can add other medicine to help you prevent the weight gain. So don't just abruptly stop the medicine because it can interfere with your health and your health condition. Okay. What are some of the things we worry about when we are obese or we overweight? First is your physical health. Obesity can affect every organ in your body, from your brain, your heart, your lungs, your liver, your kidney, your bones, your hormones, your joints, your skin, all these hormones that your body produces when you are obese can sometimes also affect these organs. So if, for instance, you have problem with your liver and they tell you, oh, you have a fatty liver and you're obese, the first thing you have to ask yourself, what can I do to help with the fatty liver? Okay. If you're having a lot of joint pain and you know it's really nothing that you did and you're obese or you're overweight, ask your healthcare provider, could it be from their weight? If yes, what can I do about it? Okay. Even your heart, like for instance, high blood pressure, heart attack, stroke, heart failure. obesity can increase those risks because your heart works harder to pump blood through additional body tissues, and eventually your heart can get enlarged and it can get weaker. You can have fluid buildup. So many things can happen. And if your heart is not working, you're not alive, you're gone. So if you have any health condition, especially relating to your heart, and you're obese, I'm sure your doctor will put you on medication, but the medication is just temporary. It's just keeping you going. It's just controlling the symptoms. But the actual problem, which is the obesity, need to be addressed. Diabetes. A lot of people have type 2 diabetes. It's just a matter of time if you're obese, because it doesn't happen overnight. It takes time, and slowly, slowly, slowly it builds up. So if you have diabetes and you're overweight or you're obese, don't just keep taking those insulin. Don't just keep taking metformin. Work on losing the weight and see if that numbers will not go down. If it doesn't, come see me. Okay? So you've heard me talk a lot about different things that can happen to you when you're obese. What's going through your mind right now? Are we going to do something about it? Or are we just going to listen and keep going? Knee pain, joint pain, every extra pound increase pressure on your knee. So if you have knee problem and you're overweight or you're obese, ask yourself, how long do I want to be in this pain? How long do I want to be struggling? Can I move around? Can I play with my children, my grandchildren? Can I walk long distance? If you say no or you don't think you can do it, think about your weight. Try to lose some of the weight and you feel much, 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 much better. Because extra pound, every 1 pound equals approximately 4 extra pounds of pressure on your knees. Okay, so if you've gained 30 pounds, that means you're actually placing roughly 120 additional pounds of force on the knees with each step that you take. So think about it. Think about it. If you have a bag of, let's say, rocks, and it weighs 30 pounds, and you wrap it around your knee and you're trying to walk, you're actually putting almost 120 pounds of force on those knees. And that's why sometimes, even if you want to have surgery, the surgeon will be like, no, I can do the surgery so you lose like 20 or 30 pounds, because it's going to destroy the prosthesis that they put in during the surgery. So think about what obesity is doing to your knees. We already talked about sleep. Obesity increases risks for sleep apnea, snoring, fatigue, poor concentration. And poor sleep also increases hunger hormones. So it's like a vicious cycle. It's just going round and round. One thing leads into the other, and the other thing leading to the other. So when you're fixing the problem, go to the root cause and let's uproot it instead of cutting the branches, because then the root is still there, which is the obesity, and the problems will still coming and coming and coming. People that also are obese experiences higher rates of depression, anxiety, social isolation, weight stigma, and a low self-esteem, especially for our young folks, our teenagers. Think about how they feel when they are obese or they're overweight, their self-esteem, the stigma when they go out, when they see their friends, to a point where some people get really, really isolated and don't have any friends. Some of them get bullied at school because of their weight. So if your child is overweight or obese, please don't ignore it. Do something about it. Please, I beg of you. I've seen it. I've even seen people kill themselves because they feel so terrible about themselves. Childhood obesity is real. Okay. Some of the things that we can do to help our children is talking to them, having that first conversation. If you don't feel like you can have that conversation with them, you have my number, reach out to me, talk to me, and I will talk to them. Some of the risk factors are sugary drinks, excess screen time, which I've already talked about, lack of physical activity. But if we lack physical activity when we are small, when you gain the weight, it's even harder for you to be physically active. So these are children that used to do well in sports, they do different activities. All of a sudden, they're not doing anything. That lack of activity can make them gain weight very rapidly. So if we don't fix it, it only gets worse. And sometimes our family eating habits, if everybody in the family is eating poorly and these children are watching us, they are also forced to eat unhealthy. Of course, genetics always plays a role. So if mom is big, dad is big, chances are your child is going to be big. Some children manage to stay small. I've seen those, but as they get older, they have a tendency of gaining the weight in their adult life. Okay. If you're a parent and your child is overweight or obese, please never make them feel worse about themselves. The words that you use, the things that you say can affect them. So be careful how you address the obesity issue with your children. I know it hurts, I know it's tough, but you have to be very, very sensitive when you're talking to them about their weight or their eating habits. And one way to do that is to develop a healthy behaviors around the whole family, not just the child who is overweight or is obese. So for instance, we're having dessert for dinner. Oh, everybody can have ice cream, but you cannot have ice cream because you're fat. No, 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 no. We can't do that. Well, but we all have ice cream, but in moderation. Or we'll have fruit instead of ice cream. So you as the parent, you have to engage the whole family and make good choices to include everybody, not just the child that's overweight or obese. Because when you do that, it's going to affect their mental health, it's going to affect their self-esteem, and it's going to make them more isolated. One thing we can do for them is to encourage them. We want to do more of family meals. We want to play outside, outdoor activities. Make a schedule of different things that you can do to keep them active and less screen time for them. Encourage them to have water instead of sugary drinks. So that means we're all having water. Not one child can have juice and the other child needs to have water. No, we're all drinking water, or we're all drinking healthy juice. Maybe we're making our own orange juice. Okay. Buy healthy snacks in the house. We're all eating healthy snacks. So instead of saying you need to lose weight, say, let's all become healthier together. Instead of saying, oh, because you're eating unhealthy, that's why you're fat. We cannot use those statements around our children or even our spouses. I've seen people talk like that to their wives and their husbands because they are obese or overweight. That's very hurtful and it can affect the relationship. So whatever you're doing, we're doing it together. It's a team effort. We are supporting each other. We are helping each other to stay healthy. Okay. I know sometimes it's harder to manage obesity in men because they have their own mind of what they want to do and they think they can take care of it. But there are a lot of challenges that affect a lot of men when it comes to weight loss. One of them is long work hours. Because we know a lot of men work a lot because they have to take care of the family. Alcohol. Alcohol consumption can increase your risk of managing your obesity, especially in your abdominal area. So you see a lot of men that have the pot belly. Some of them is alcohol, sometimes it's just the weight, food eating too much or drinking too much. Okay. Late night eating is not good. It's funny. I've had a lot of patients that will come to me and say, "Oh, I know what the problem is because I eat late." So my question back to them is, if you know the problem is you eating late, so why don't you stop eating late? Right? So if you work till maybe 7 p.m., meaning you don't get home till like 8 or 9 p.m., take your dinner to work so you can have it around 5 or 6 p.m. When you come home, you can just drink some water, a cup of tea, or some healthy drink, go to bed. You can't come home at 9 p.m., 10 p.m., and eating a full meal. It's not healthy for you. We want to reduce stress because stress makes the problem worse. Find those triggers, find the things that are stressing you, and find solution to those problems, or just say, hey, I cannot fix the problem. I'll leave it out to God and let me keep going. Men also are less likely to go to their doctors to see what is going on in their body, because sometimes the problem is not anything that you're doing. It could be some issue in the body that is causing the weight problem. Go get your health checked. Okay. Exercise. If we don't exercise and we keep eating, we're always in the positive when it comes to our calories. For you to be able to lose the weight, you need to be in the negative calories. So let's say you put in 100 calories and you burn 100 calories, you maintain your weight. You put in 100 calories, you burn 200 calories, you lose weight. You put in 100 calories, you burn 0 calories, you gain weight. Okay, so it's very proportional. Okay, so make sure we're doing exercise, regular exercises. It's going to go a long way. It's not working out 20 hours a day that's going to make you lose weight and still healthy. It's the consistency. If you can average maybe 150 hours in a whole week, that's good. You can after 150 minutes in a week, that's good enough. Okay. So if you have a busy schedule, maybe on your lunch break, you can go for a walk. Maybe after work, take your workout clothes with you so you can go to the gym before you come home. Or in the morning, try to work out before you get in the shower and go to work. So you need to create a routine. You need to have a schedule and be intentional about it. If you know from this time to this time, it's my workout time, don't let anything interfere with it. Even if you have to give up other things, especially for your children, to go work out, please do it. Unless it's life and death or it's very urgent. If not, make sure you're working out. And also make sure you're doing strength training. When you do strength training, you build more muscle mass. It's good for your bone density. And overall, it makes you tone up and look good instead of just looking floppy and, skin hanging out. Make sure you do some strength training. It's also good for your cholesterol and your insulin. Okay. Do your regular medical checkups because you never know. Your weight gain could be a result of something else that's going on in your body. So just ignoring it is not going to fix the problem. I know we may have some questions. You know, women, I know we've talked about the men, manage your obesity in women. What are some of the unique factors that make you gain weight? Pregnancy. Most people gain weight when they are pregnant. I have few people that lose weight during pregnancy, but most people gain weight during pregnancy. And usually after the pregnancy, you're supposed to go back to your pre-pregnancy weight. Some don't. So if that happens, what do? You need to work harder, exercise, eat healthy, sleep well, reduce stress, drink water, and you should be fine. Okay. Sometimes people have diseases like, a condition called PCOS. PCOS has been around, and people know they have it. Some people don't know they have it. But if you have a history of it, you know what you need to do. Talk to your doctor. There's help for you. If you don't know you have it, when you have conversation with your primary providers, ask them, can we get tested? Or can, especially for young girls, teenagers, always ask your pediatrician, can we get tested for PCOS? It's just different blood work that needs to be done to see what those numbers are. Okay. Caregiving. Sometimes we work hard and we're also taking care of our children, sometimes we're taking care of our parents at the same time. All those things can put a lot of stress on us. It can affect the way we eat, the way we sleep, and our stress level, which hence make us gain weight. Hormonal changes, menopause, perimenopause, all those things can affect our weight. So, yes, because we are reaching our 40s or 45, 46, 47, and you're starting to have the night sweats, you're starting to have the hot flashes, you're starting to have those mood changes, get tested for your hormones. Your GYN can test you, your PCP can test you. Hey, just for information purposes, what's going on with my hormones? Okay. Stress reduction, um, balanced nutrition. I mean, I know sometimes we want to eat once a day or twice a day. Please, that's not how you lose weight. And sometimes people say, that's how I've always done it. I've always eaten once a day. As you get older, eating once a day is not healthy for you. So I would rather advise that we eat balanced meal, balanced nutrition, more fruits, vegetables, protein, carbohydrates, fat. It has to be a balanced meal. Okay. And if you need mental health support, there's a lot of help out there. Don't ignore your mental health because that can put a lot of stress on the body and affect your sleep and make it difficult for you to lose weight or make you gain weight. Okay. It's all about talking to the right people and having that conversation. What about obesity after menopause? Yes, or maybe somebody had hysterectomy. There's a lot of hormonal changes. Our estrogen level declines, muscle mass decreases, metabolism slows down, fat starts shifting towards the abdomen. All these things affect us. So once you know there is a problem, you know something is wrong, get yourself the right advice or the right people that can help you. Don't just assume, oh, it's because I'm in my menopause or because I stopped having my period. That's why this is happening. It's best to get a professional advice. Okay. We will do our exercise. We want to eat more protein because protein fills you up quicker. You go longer without being hungry. It also have amino acid that helps build more muscle mass. Hence, that helps burn more body fat. So make sure you're doing high protein diets. Make sure you have your calcium, vitamin D. That's a big one. If your vitamin D levels is low, or your doctor tells you, oh, you have low vitamin D level, don't ignore it. Get medications. They can put you on 50,000 IU once a week, or you can get it over the counter. Take it every day. I would actually recommend us just taking the vitamin D as part of your daily routine. Okay. Sleep hygiene. You got to sleep well. If you're not sleeping good, talk to your doctor. There may be other reasons why you're not sleeping. I know we did a podcast on sleep disorders. Don't just assume it's normal. It's not normal for you not to be able to sleep. So if you can't sleep, please talk to your doctor. Let's do sleep study. Let's see what's going on. We already talked about our fruits and vegetables. We want to have more whole grain. We want to add some lean protein, healthy fats, fiber, water. We definitely want to limit ultra processed foods, sugary beverages, highly refined carbohydrates. We want to limit those things because they don't help us. Instead, let's do more whole grain. Okay. If you're doing all this and nothing is happening, you're not losing the weight or you keep gaining the weight. That's why some of us are here for. We went into this profession so we can help people lose weight, stay healthy, and feel good about themselves. Okay. That's why Transformation Center for Weight Loss is here for you. And we see patients virtually, we see patients in person. We are located in Maryland, Delaware, Virginia, we're in Texas, soon we'll be in Massachusetts, and we do virtual. So pretty much wherever you are, even if you're in Ghana, we can help you. So don't feel like you have to fight this battle alone. It's a battle that sometimes you're not going to win, but there is help. We'll help you with your lifestyle changes, behavior modification, nutrition counseling. Some patients need medication. We prescribe any FDA approved anti-obesity medicines or appetite suppressants. We've heard about all the GLP-1s out there. Wegovy, semaglutide. We've had Zepbound, tirzepatide, Mounjaro, whatever it takes. Okay. Now they also have it in a pill form. Wegovy, we can get it in a pill form for you. And also Foundayo, which is the pill form of Mounjaro, and Zepbound is working. People are taking it. It's on. You have a discount to it. So if you're interested, you need to let us know. We also have patients that none of these things works for them, so they go with surgery. With surgery is also an option if that's what it's going to take. There's different forms of bariatric surgery that you can have, and most insurance pays for it. So if you think nothing has worked or nothing is working, surgery is also an option. Okay. The treatment should always be individualized. So don't feel like, oh, this person did this, so I'm also going to do the same thing. Everybody's different. Our body is different. We react to different treatments differently. Even I've had twins that respond to treatment differently. So don't think it's a one size fit all. Everybody's different, and we need to treat each one as an individual. Okay. Being obese is not a matter of willpower, it's a disease process. It has a lot of different things coming together to cause the problem. So it's nothing that you did to yourself. Just remember, obesity is a chronic disease, it's complex, it's multifactorial, meaning there are different aspects of it. Okay. It's treatable, it's preventable in many cases. Once you manage it well, you will do well for the rest of your life. Okay. So I'm going to end here because it's almost an hour since I've been talking. So if anybody have a question, if anybody want to ask a question, please, this is a good time for you to ask your question. And also, we are going to give out some promotional deals if you want to sign up to get help. Consultation is going to be free for you just because you watch us and you've heard me talk about obesity. You can join us for you can schedule a consultation for free, and we'll also give you a 50% off if you decide to join the program, because this is a serious issue and we want to make sure that everybody is getting the help that they need, because obesity is robbing a lot of people of quality life. We've seen a lot of people lose their lives because of obesity. Yes, the doctor may say diabetes killed you, high blood pressure killed you, kidney failure killed you, but a lot of times it has something to do with the um, obesity. So don't be part of that statistics. Guard yourself. Guard yourself so you can live long and healthy and fulfill your purpose on earth. Because it's hard for you to do God's work if you are not healthy. So don't let obesity kill you. Don't let it steal your joy away. Don't let it limit the things that you can do in life. And I'm going to end here. Thank you all for listening. And those who weren't able to listen or to join in, it's going to be on YouTube. You can join in later. You can watch it. You can like it. Please share it because you never know who will benefit from it. Thank you all for watching. We are going to end and we will join you guys out there. And if you have a question later, you can always reach out to me. 443-623-6080. Okay. All our information are here. If you need to take a picture of it, you can. But if you haven't subscribed to us YouTube channel, please do so we can share all this information with you once it's ready. Yeah. All right. Thank you all for joining and have a good night.